Good evening, everyone, and welcome to another episode of A Closer Look, the show dedicated to bringing you the facts. We ask the questions no one else will, and we get the answers that no one else can. I'm Arabina Apia. Thanks so much for joining us. Healthcare in the Bahamas is a lifeline. Whether it's the rush to accident and emergency in a critical moment, the life-saving work of the blood bank, or the assurance that comes from knowing that skilled professionals are ready to meet the needs of their patients. But if we're being honest, it hasn't always delivered the way it should. What is also true, though, is that ours is a system in progress, a system being shaped by these challenges and the people determined to overcome them. Tonight, we're taking a closer look into the latest developments, plans for the future, and so much more. So stay tuned, because A Closer Look gets underway right after this break. Welcome back. You're watching A Closer Look. I'm Arabina Apia. Thanks so much for joining us tonight. Our healthcare system is evolving, and nowhere is that more evident than at the newly renovated Accident and Emergency Department. Up next, we take you inside to explore how these upgrades are transforming care and hear directly from the leaders making it happen. For more on this, we go to our very own Krishna Russell. Krishna?
If you visited Princess Margaret Hospital's Accident and Emergency Department recently, you've noticed teams up and about carrying out much-needed renovations. And as officials tell us, they have one aim in mind: to upgrade the patient care experience. It's out with the old and in with the new and upgraded. The Accident and Emergency Department has undergone renovations.
So we are so pleased to have had this experience in terms of the renovation of the emergency department. We look forward with great anticipation for occupying this space. This space is at least double the space that it once was, and as a result, we will be able to service the population, the community, and indeed the wider Bahamas in a more efficient and comfortable manner.
The new upgrades further mean there will be greater ease and comfort for those seeking emergency medical care.
Before, when patients would have come to the hospital, we didn't have individual rooms to see patients, and a lot of times it was uncomfortable and not the best environment. In this new space, we have at least 8 new rooms that we would see patients in, and then we also have an observational unit, a step-down unit, where we would take the patients once we would have seen them.
And she says the upgrades also mean that the Accident and Emergency team is ready to serve with care and expediency, should there be periods of greater demand.
We welcome everyone. We're open and we're always available to take care of our patients.
Now, officials say the buck does not just stop here, but there are more upgrades to come throughout the country. I'm Krishna Russell for A Closer Look.
We hope you stick around, because there's more show and our deep dive into the state of healthcare coming up after this. This is BDC Living, where we bring your indoor and outdoor living dreams to life. And as the holidays roll in, you can give the gift of BDC with our selection of festive home decor, trinkets, and treasures to make your holidays even more festive. Visit any of our BDC Living locations today and let your dream decor journey begin with us. Welcome back. You're watching A Closer Look. Thanks so much for tuning in tonight. I'm Arabina Apia. Healthcare isn't just about buildings. It's also about the people stepping up to meet critical healthcare needs. One place where that is constant is the PMH Blood Bank. And our Jillian Gray tells us more about their life-saving work. Jillian?
Arabina, in this season of giving, the greatest gift that you can give is the gift of life, and that comes with donating blood.
When we talk about giving the gift of life, you're actually making a big difference in quality of life for many patients you don't see every day, but they may be sicklers who would need blood. They may be persons who are on dialysis, persons who need their chemotherapy treatments. These are the type of persons that we are looking to help each day. So giving a gift of life means that you can save 3 persons.
The new blood bank facility just off Collins Avenue offers an upgraded space for blood donation. Opened in May of this year, it has solved long-standing challenges like limited parking and flow of processes for donors.
It's a better ambience as well, being off campus from the Princess Margaret Hospital. It's a little bit more, spacious, I think, for the donors coming through, and it's more comparted or segmented, so they can walk through and just walk right back out.
In the past, blood donations were scarce, but Supervisor Jalna Bullard says they've seen a steady increase in donors. Now, the focus is on maintaining a reliable flow of healthy donors.
We've seen where we may get like 6,000 persons that really come in to be screened to donate. However, we continue to see that number falling down to 3,000 donors for eligibility. So we have persons a lot of times who come in who are anemic or whatever other criteria that disqualifies them from donating. But we do see people more persons attempting to come in and to donate.
For those hesitant about needles, Miss Bullard offers reassurance. She says it's no worse than a mosquito bite. They also have skilled and compassionate phlebotomists who are dedicated to making the process as comfortable as possible. And what does it take to be a donor?
So you must be 17 years or older. We require that you do not have any tattoos, hair piercing, or surgery within the past 12 months. You must be in general good health, no antibiotics, probably within the past 2 weeks, no colds or flus in the past 2 weeks, no major dental surgery within the past 4 weeks. So those are the major criteria.
So in the spirit of giving this holiday season, consider donating blood so that you can give the gift of life. For A Closer Look, I'm Jillian Gray.
Stay tuned, there's even more show right after this.
Every season creates an opportunity for you to enjoy the comfort and security of your most valuable assets. Unfortunately, termites are common and very unwanted guests that never stop eating. With Struckum, you can enjoy the peace of mind as we protect your investment with our 3-year fumigation warranty. Struckum, #1 in pest control services.
Welcome back. I'm Arabina Apia, and you're watching A Closer Look. Thanks so much for tuning in tonight. Behind every healthcare milestone are the dedicated professionals who are ready to make it happen. ACL correspondent Amber Arana has the details on the programs designed to shape the future of psychiatric nursing and patient care in the country. Amber?
Hi Rabs, I'm here at Sandilands Rehabilitation Center, where the Public Hospitals Authority Academy is celebrating a major milestone in professional development.
We spoke with Ms. Joanna Curry, a senior nursing officer in the PHA, who is currently a coordinator for the second cohort of the Clinical Nurses Training Program. She gave us the rundown on what distinguishes the psychiatric mental health program from other nursing programs.
We look at the biology relative to the individual, their social situation, and we try to encompass all of that in a comprehensive curriculum that speaks to the person's physical, their mental, their psychological, their social, even the environmental factors that would impact on that individual's level of functioning. And our aim is to bring an individual to their optimal level of functioning.
Top graduate of the psychiatric nursing program, Tamara Curry, encouraged aspiring future nursing students to join the program, emphasizing that
there's a rise in mental health crises in the country, and we need psychiatric mental health nurses. We need trained professionals to be able to provide the care and fulfill the needs that our clients have.
Along with the recent psychiatric nursing graduation, the PHA is also anticipating the upcoming graduation for the patient care assistant program. The graduates of this program will be expected to assist nurses as they render care to the patients at Princess Margaret Hospital, Grand Bahama Health Services, and Sandilands Rehabilitation Center.
So the complement of PCAs will enhance the care and the number of persons available to render care to the patients.
As the Public Hospitals Authority Academy continues to produce skilled healthcare professionals, the impact on our healthcare system is undeniable. From mental health to patient care, these graduates are shaping a brighter future for Bahamian healthcare. Reporting here from Sandilands Rehabilitation Center, I'm Amber Arana. Back to you, Rabs.
Thanks, Amber. Really inspiring to see the effort to train mental health professionals. When we return, our deep dive into the state of healthcare continues. Stay tuned. A Closer Look is back after this.
This is the National Youth Guard program designed to train young people to help the Bahama Islands in times of disaster.
I decided to join to better serve my country as well as to better myself.
We train the help in search and rescue,
electrical, plumbing, and carpentry,
and things that they can actually expand on in their careers.
Young people who join the Youth Guard program discover a sense of identity, a sense of purpose, and a sense of patriotism.
This program isn't about only the individuals, it is about the country.
Welcome back. You're watching A Closer Look. I'm Arabina Apia. Thanks so much for tuning in tonight to our health episode. Joining me in studio now is the Minister of Health and Wellness, the Honorable Dr. Michael Darville. Welcome to the show.
It's good to be here.
Thank you so much for being here. I want to jump right into our conversation because over the past several weeks, months, years, Bahamians would have been noticing some of the sort of incremental upgrades and changes that have happened in healthcare. Can you speak to some of those changes and what is the government's overarching vision for healthcare in the country?
Well, thanks a lot and good to be on the show. On coming to office in 2021, our administration clearly articulated where we intend to take healthcare. And from 2021 to the present day, we have been executing our plan. The first thing in our plan was basically to control the pandemic. I think we did an excellent job in doing that, to navigating us through those turbulent waters and to get our tourism and economic sector back on right footing. The second thing was to address the manpower shortages and the excessive workload on our healthcare workers, and we're addressing that through industrial agreements. The third thing was to digitize healthcare systems. We are presently doing that via an IDB loan facility. And the last thing is basically infrastructural development, both in primary and tertiary healthcare delivery systems. Mm-hmm. We're doing that.
Mm-hmm. I know that, in speaking to persons within healthcare, both here in the capital and on the Family Islands, there seems to be a really intentional push toward improving patient outcomes and experiences. Those are now priority issues. Now, how do we take those priorities, or how does the government plan to ensure that these goals actually translate into measurable improvements that Bahamians can see and feel when they go into public healthcare facilities?
Well, first of all, the Bahamian people need to know that healthcare delivery systems is not only New Providence and Grand Bahama. We're an archipelagic nation, and it is our responsibility at the Ministry of Health to make sure that the health experience at our public healthcare facilities are even across the board, which means that what a patient would experience in New Providence should be reflective of what is going on in the Family Islands. The way that's done is we had to take a closer look at our infrastructure, shortages in manpower, resources, digitization, to ensure that our clinics, particularly in remote areas, patients can have a similar experience as New Providence. And we have been working diligently towards that. I believe that we are close to achieving that goal, and that the residents to our far-flung islands can rest assured that they would not be left behind.
I know that one of the issues often facing the healthcare industry, the healthcare sector, is funding. Healthcare is expensive to provide. We are in a very unique position because we are an archipelago, and like you said, what is happening here in the capital should also be reflected in the Family Islands. Can you speak to how the government is managing budgetary constraints and issues that may come up from that? You mentioned earlier an IDB facility. So what other budgetary considerations are being given to ensure that we actually have access to quality healthcare in the Family Islands?
When we look at the healthcare services throughout the country, and we look at the Public Hospitals Authority, we look at National Health Insurance Authority, and then we also look at the Department of Public Health. These are all agencies along with the Ministry of Health and Wellness. Funding is allocated for each agency. In our last budgetary allocation, we noticed increases in the Department of Public Health because our agenda is to improve our services provided in the Family Islands. By way of the IDB loan, it's broken down into various components: infrastructural upgrades, policy reform, digitization, and we are now utilizing those facilities to ensure that we upgrade the services in the Family Island, and funding is clearly put aside for that. I'd like to point towards our emergency medical transport systems on the ground. A couple months ago, you saw where ambulances came. That is all a part to ensure that each Family Island have an ambulance. So in the event that any one of our loved ones experience a complication that needs emergency medical transport, we have those equipment on the ground that will tie it in with our clinics and air ambulance. So we are transforming systems in the Family Islands to ensure that the experience is reflective of what's happening in New Providence and Grand Bahama.
Let's talk about Grand Bahama. I know that the new medical facility is underway there. Can you provide any updates on where we are and when Grand Bahamians can expect to see that facility open and feel the impact of that additional care?
Well, I'm glad you brought it up, because for years the Rand Memorial Hospital has been stressed, and our administration made it very clear, should the Lord bless us with an opportunity to govern, we will construct a new state-of-the-art facility in Grand Bahama and likewise New Providence. I'm pleased to report that the infrastructure for the new Grand Bahama Health Campus is on the way. We anticipate that the latter part of next year, we would be able to see an operational component of Phase 1A and 1B of that facility, which will require more manpower, resources, and training. And that facility will have both primary, some secondary, and some tertiary components added to it with diagnostics, inclusive of CT scan and MRI. We're excited about how the project is progressing, and very soon we are looking forward for additional training in Grand Bahama so that we could meet those labor requirements and manpower work components that would be necessary for the facility to function effectively.
You mentioned earlier the pandemic. In Grand Bahama specifically, it was not just the pandemic, but just before it was Dorian. And so, there are sort of events that can reveal what might be considered critical gaps. What is the government doing in terms of making healthcare facilities, hurricane ready, able to withstand any sort of natural disaster, so that people can continue to receive care even in crisis situations?
Well, first of all, I would like to thank the healthcare workers in Grand Bahama who went through a very traumatic experience with Hurricane Dorian. For the first time in Grand Bahama, the Rand Memorial Hospital was flooded. where there was massive surges coming into the main city of Grand Bahama and impaired healthcare delivery systems. This was a major challenge for us, and this is one of the reasons in our planning we saw fit to move the construction of phase 1 and phase 2 of the new tertiary healthcare facility for Grand Bahama on higher ground. This will ensure that in the event that we experience something of the magnitude of Dorian, the hospital will function effectively and there would be accessibility to tertiary healthcare services. As far as infrastructural upgrade throughout Grand Bahama, I'm pleased to report that remedial works were completed at the West End Clinic, the 8 Mile Rock Clinic in East End, as well as the Hawksbill Clinic. And we're very pleased that we intend to bring in additional manpower resources to improve the service and extend the hours of the service. It has always been our plan to ensure that the 8 Mile Rock Clinic have extended hours, which can act as an urgent care facility and try to alleviate some of the load at the accident emergency at the Rand Memorial Hospital. So in Grand Bahama, we have a plan. Our plan is to ensure that we provide additional tertiary healthcare services for the people of Grand Bahama. And on the completion of that facility, we intend not to have 2 campuses. We would downgrade the current Rand Memorial Hospital into a secondary facility, and we will have 1 major campus for tertiary healthcare deliveries. The Rand Memorial Hospital will be utilized for geriatric services and more psychiatric services, incorporating those 2 lovely theaters that would be left behind for same-day surgery. So we have a plan for Grand Bahama and the northern region for tertiary healthcare services, and we intend to execute that plan with phase 1A and 1B of the Freeport Health campuses, which we intend to have a turnkey operation sometime in the latter part of next year.
Okay. I guess my final question to you, Minister, is about the future. Outside of addressing some of the immediate concerns that you've brought up today, outside of addressing, some of the active things that need to happen, what is the 5-10-year plan for healthcare as a whole?
Well, this administration have a plan for healthcare. First of all is manpower, resources improvement. When we speak about the construction of new state-of-the-art hospitals, we realize that we have manpower shortages. And so our manpower shortages is categorized in 3 areas. Short-term, which means that if there's deficiency in the country, it is our responsibility to bring in workers to assist us to fill those gaps. While that's happening, we must have training. We must have training of nurses, doctors, allied healthcare workers, administrators, IT individuals, to ensure that we modernize our healthcare services and take us into the 21st century. Lastly, we need to come up with a new model for financing for healthcare, and that is by way of national health insurance. Our goal and our plan is to ensure that every citizen in the Commonwealth of the Bahamas have access to healthcare services, and that will happen by way of national health insurance, where we are moving in a direction where every citizen in the Commonwealth of the Bahamas will become a private patient and have access to services both in the private and public sector.
Absolutely.
We have broken up our healthcare services in both private and public, but it is one living organism. We are now in communication with the private healthcare sector so that we can coexist and provide better quality services in the Bahamas and keep resources in the country rather than seeing the migration to get health services abroad.
Absolutely. But I think that's a really good place for us to end there, Minister. Thank you so much for being here. I think this has been a really insightful conversation. I know Bahamians are excited for the improvements, and we're hoping that we get to see those sooner rather than later. So thank you so much.
We're looking forward to implement them by way of PHA, NHI, and by way of the Ministry of Health and Wellness.
Absolutely. Well, thank you again for being here.
Thank you.
Now, as you've heard from the Minister, the government has a comprehensive strategy for meeting its national goals in healthcare, and the Public Hospitals Authority will continue to play a major role in making those goals a lived reality. We sat down with the Managing Director of the Public Hospitals Authority, Dr. Abinette Roll, for her insights on the way forward for the PHA.
Sure. So one of the things we must recognize is that the Princess Margaret Hospital is an old building. It's 70-something plus years old. And with that, obviously you have some infrastructural issues that are going on. And so one of the key drivers is, as we move forward with talking about a new hospital, we need to ensure that in the interim period, we have a place where patients can be stabilized and treated. So the driving force is really to provide an upgrade that allows any patient to be able to come there and get the level of safe quality care that is required. Our main focus is always the gateway. An emergency room is the gateway to any health facility. And one of the things we wanted to make sure was, previously you had what we call an open floor for care. Now we have pods where persons have the level of privacy for discussions and also for care to happen. And that's very, very important. So emergency room is just one place. We also have, and you would have seen it out of COVID pandemic, persons with comorbidities like hypertension, diabetes. Those individuals require what we call internal medicine to care for them. And so we're really upgrading the medical area, as well as with any other person. Persons have surgeries, some are planned and some are emergency surgeries, and so they need that surgical care. So we're also upgrading the surgical ward, pediatric patients in an emergent area. And we are happy to say now that once we fully open up the emergency room in particular, we have a space that is really dedicated for pediatrics that also allows the guardian or the parent or any next of kin to be able to stay there with the minor to ensure that they're getting care. So there's quite a bit going on at the tertiary level, but there's also the same amount of renovations that are going on in what we call the primary health settings, and they are the clinics in New Providence as well as the ones in the Family Islands, because there has to be a balance.
Stay tuned. We have more show after this. Healthcare isn't static. It shifts and adjusts, often under pressure, to meet the needs of the people it's meant to serve. Tonight, we've seen glimpses of that evolution. Facilities built to handle emergencies with greater efficiency, initiatives to address critical shortages like blood donations, and professionals stepping forward to care for the nation. And at the heart of it all remains the same mission: ensuring that every patient's experience reflects not just competence, but care. Getting there means tackling real challenges, access, resources, and infrastructure with urgency and resolve. And it's a shared responsibility. The government's commitment, the system's capacity, and of course, all of our engagement as citizens. This conversation does not end here. Progress takes time, but each step brings us a little closer to the standard that we all deserve. Till next time, ladies and gentlemen, I'm Arabina Apia. Thanks so much for watching, and good night.